السلام عليكم ورحمة الله وبركاته.
وعليكم السلام ورحمة الله وبركاته دكتور أهلين.
Okay. I just want to make sure that my voice is clear.
Clear دكتور.
Okay, thank you very much.
You're welcome.
First of all, I'm welcoming all of you, and this is my second time to join these sessions with you, inshallah, today.
Recording in progress.
Okay. Inshallah, today in this course, Communicating Public Health Informations, we will have a small part which is related to translating public health data in terms of formats, and we will discuss also the challenges and the areas about the public health data. The topic it is mainly concerning and focusing in public health informatics. And in our discussions today, we may have agreed details and elaborations in public health informatics, as it is a basics of communications, and also it's a basic of the data and the high quality of data which is utilized and used in public health field as journals. Before we start, I just want to introduce myself. Adam Douria, Dr. Adam Douria. I'm assistant professor in public health at KKU. I joined KKU since 5 years ago. Before that, I was attached with Shandy University, and also I have so far I have also consultancy period with WHO. I had missions, short-term missions with WHO during polio eradications and Ebola crises. I was also working in Ministry of Health in Sudan in EBI program under the primary health centers department for more than 12 years, mainly in my area of focus. It's mainly on immunizations and surveillance, screenings, and other parts of the community medicines. Okay, let's jump. Okay, sorry. Our learning objective today, inshallah, by the end of this lectures, as I mentioned, we should be able to describe the major area of public health informatics and the relations to the communications. As we are starting talking about this, we are starting with that. There is a great relations between informatics as quality of data and communications. And also, we should be able to understand how and why information systems are developed and used in public health communications and actions. We will go to go in deep to know the purpose of initiating or creating the public health systems as information system, and how also we can utilize these types of data and informatics in terms of the increasing the performance indicators inside the public health, the sub-public health domains. We should be also able, by the end of this lecture, to identify and utilize public health informatic approach and tools, which types of the tools that is used as public health informatics, and how we are utilizing them. Finally, also we should recognize the challenges, barriers, and obstacles, and also opportunities which is come from using these highly sophisticated techniques to come out with these informatics that is support the public health interventions and public health activities. As introductions, we are in public health. We used to initiate and introduce John Snow as the initiators and the father of epidemiology, and also he is a father of the analytical epidemiology. Since that times, in 1950, when he started studying the problems of cholera in London, he's the first one who is utilized the data in terms of solving the health problems and also using this data in the interventions of public health activities. So public health is fundamentally based on data, even as far as that John Snow started in London. The initiation was in collecting the data, analyzing that data, and managing the data, and finally come out with the answers, which is like solve the problems of the outbreak in that time, which is answer the questions of what is the source of infections and how is the diseases spreading and who are at risk. This comes after a serial analysis of data. Since he is conducting that active search, looking for cases, gathering that data from the cases in terms of time, place, and persons, and he starts presenting this data in tables and putting it in a spots map, and finally come out with the main. So I believe we all know this is, but here is just we are going to make a linkage that is the importance of data. This has been initiated since decades. The field of public health has been strongly influenced by advanced in information technology. So far, we all believe that the public health field needs these sophisticated IT technologies to increase the outcomes of the activities or the interventions in this field. As a definitions or as a background or overview of health communications, you know that health communications is an evolving and increasingly prominent field in both public health and non-profit medical sectors. Communications itself, it could be coming under several domains. And when we talk also about health communication, also we can't talk about any interventions in public health without communications. Since we have a direct communications community or a communication within health workers or a communication as a part of the communications as a report or whatever. So finally we may find. So that's why we may have a different types of health communications in the field of health in general. And when we talk about health communications, we may gather a different tense of definitions regarding the health communications. This is because of the multidisciplinary natures of health communications. Many of these definitions may appear somewhat different from each other definitions, as it could be as a term of the within communities health communications, within community staff, health worker staff, or within the types of the data which is supposed to be referred, and the data that should become as feedbacks also as a term of communication. The types and the uses of the technologies are dynamically, fundamentally changed how knowledge and informations are. Since John Snow started that gathering the data to use it in public health purpose, types of this data, how we are obtaining it, gathering this data, how we are exchanging this data either within institutions or within individuals, health practitioners or health workers or professionals, and also the way of interpreting and explaining, analyzing these types of data. It has been in a serial and running of changes in knowledge, and this comes as usual developments of the types of technologies and developments in science. So here it means it is fundamentally changes in the term of the different way and domains of the data domains. All are resulted in the development of distinct disciplines called public health informatics, which is related to the past communication. So whatever we are making modifications or making any improvements in any term of or any part that related to the communications, health communications informatics, and this is finally it has to become under public health informatics, and this is related to the health communication. So that's why we cannot distinguish, we cannot differentiate between health communications and health informatics because they both depend on the data, they both need methods, they both need canals to be achieved. So talking about public health informatics or informatics itself, it would not be completed unless we have additional talk and recapping talking about the health communication. Public health informatics established as the results of the interactions of the things. So the public health informatics is not a one-way, it's a one-way job or one-way activities. These activities, it's linkage and it's associated with others, either technical facilities or technical tools or other knowledge and also level of trainings from the level of training from who are participated in this activity. So it comes finally as interactions of these sciences, practices, informations, availability of the computings like devices and public. All those are together are like buildings, the general share of public health informatics. Finally, you come out when you to come out finally with the high quality data, which is reveal high quality informations, which is support on plannings or supported the decisions makers in the field of public health. We need to have associations and interactions between these two, these different domains. It means without the connections and interactions of these different domains, we are not going finally to have an effective, efficient health, public health informatics system. What I started in the learning outcomes, it comes as a great relations between communications and informatics, and still we are elaborating this just to reflect the importance of the connections and affiliations between communications and informatics. There is a close relations between communications and informatics because informatics has substantially improved the availability of information. We all believe without data, without informations, we cannot achieve the public health. We cannot achieve the public health goals. So it means the quality of the data that comes from the public health sources, it needs to come through the informatic systems to finally support the communications system in whatever levels that we are mentioned, either it is personally or for the community or within the institutional. So whatever types of communication that we are mentioned, finally we have to finalize these types of informations and data in high quality and performance, which is support the activities. Information is science, we know, and we are just taking the nutshell part of this science to utilize it in public health system. You know. And there is a separate specialty of the information science, but here we are not going in deep to go through this science, but we should know the basic things that is in the information science. The science, it's a different classification things. It's been used to characterize it in informatics, and it's used in health and public health field. So this is dealing with gatherings the data. So you know that is different sources of data that support the health systems, managing this data in terms of the type of data that is supposed to be collected or supposed to be collected, and also the the types of the sub data, like which domains that is in sub data we are or we need to be collected, classifying the data or retrieving the data. Also, we should have the system should have as good facilities for retrieving data, calling data wherever you are want to use this data, storing data, archiving the data for either for futures or for also the prompt use in case of there is an emergencies, or using the data for planning. So here we have also to have an effective smooth system for retrieving, storing the data. This is, it could build the cycles of information science. To have a good quality of data, you need to have a good system of information, which is supported the tools for gatherings, process for managing, expert for classifying, system facilitations for retrieving, storing systems. So finally, you may be sure that your system could support your objective to achieve the goals that you are looking for. And here I'm transforming recorded informations, transferring recorded information, transferring it to the way that you could use it in your systems. Use it in planning, or use it in decisions making, or you can use it also for initiating and developing policies, or use it for the evaluation of the existing programs that you are maintaining. Information sciences, if we are talking about it, it's informatics is applicable to many health areas. All areas of health, especially public health, need to have a clear informatics system. So this is include like medical informatics, like use of IT in healthcare settings, or bioinformatics. This is also, it's like any domains in medical informatics, how we can use these types of informations in developing like new medicines, developing new preventions and controls, and measures like vaccinations. So it is also dependent on the informatics system. And also, which is involved advanced computing techniques and information system for basics biomedical researches, like genetic risk for the diseases, now like the bioinformatic research is about genetic diseases like cancers, and also diseases, the research is regarding the vector control, how we can use sterilizations of male in vector control. All this is lie under the biomedical research. All this is depend on informatics and especially bioinformatics. Now, talking about the principle of the informatics. Principle of informatics, the general backgrounds, the general frames of the informatics and health informatics, like from where we gather this data, how we are using this data, if there is any need for provided data out of the field of public health. So as we know that is, as general in public health, any public health interventions that we are or we need to have interventions, there is an three domains or three pillars that we supposed to consider, like thinking about community as a participations or community development or community involvement is very important. This is number one. It's very important in terms of acceptance. It's in terms of taking the ownerships of taking this new activities, and also the way of utilize the intersectoral coordinations, like other parts, education, economics, agriculture, people who are out of in the public health, but we still need to collaborate with them to achieve our final goal. So here also we have to think. Finally, and very important things also, we have to seek the political support because of the acceptance. Like we need to convince the governments to accept our programs, to fund the to give the resources and to fund the activity. So this is three pillars. When we look for the principle of public health informatics, we are recognizing these three domains inside this four principle. First, recognitions of the influences of the governmentals and other processes in public health informatics system. To establish this system, you need to have a full support from the government. So government, because now you are talking about this system to be as a policy in your institutions, either ministry or disciplinary or whatever. But here you have to convince the government because this program needs more and more technical, financial support. Otherwise, you cannot achieve the program. So promotions of health in general populations. Like the majority of these public health informatics programs depends on gathering the data, utilizing the data, and finally using this data. Finally, we are using this data to promote the health or to like elevate the level of health status amongst the populations or in community. It's not something that is used for a personal, I mean for individual health. No, we are providing the systems to come out with the benefits of the whole, promoting the health of the whole populations. Emphasis of the prevention of the diseases and injury by alternating the conditions. As far as possible, we have to facilitate our public health information system to alerts systems to prevent the either epidemics or re-emerging diseases, emergency situations, disasters, and this is what the people are working, especially in public health, on it. So utilizing public health informatics to give and draw actions or to give an alert about the what will be happens in regards to the diseases, injuries, and to support also other types of the disasters and emergency preparedness. Considerations of prevention opportunities wherever they may exist. Finally, I just have like here, I have mentioned that is in the way of the considerations of prevention opportunity wherever may exist. as examples, publics or organizations or policy intervention. So that is means it has to be works in public activities or organizational with another organizations or policy interventions like initiating new policies in either healthcare systems or public health interventions. So here we are just going to explain the discipline contributing to public health as general. And as I mentioned, one of the three pillars that is needed in public health is how far we are collaborating with other sectors out of the public health field. And this is exactly consisting the sectors collaborations for the institutions, agencies, where they don't have a great or direct relations with public health. This is just also to support the public health, supporting public health by other direct, indirect ways, also supporting the health informatics and data provided in public health, like computer sciences to facilitate, to give, to maintain the assistance of the informatics, information sciences also. Business management for logistics, psychology, communications, technology, statistics, law as a public health law to protect. As we are going also to discuss the relations between public health data and law. Is it protected by law? Is it exposed for anyone who can collect any types of data? Are the ethical issues also? So here also we need to collaborate with law, health promotions, health educations, engineering, and other behavioral sciences, laboratory sciences, and agencies. All they are collaborating on the public health informatics by closers or far. So we found that is they are in the field. Here we have examples of data system designed for early detections of potentially acute public health diseases or conditions. I try to give you this just to highlight it. That is, we have a broad area for using the public health informatics or public health data. And we have also a broad methods and tools to prevent this data. And these issues, it has been, and this field, it has highly progressed, especially in developing countries. Now this example, what I'm just reflecting here are the examples, it's from UK, it's from US. But 50% of the systems are existing even in developed countries. I'm sure here we may have a much sophisticated than this in Saudi Arabia, but in different system, in different way. Like Sentinel surveillance networks, it's also using the health facilities, selecting health facilities for notifiable diseases and reflected in ISWA smart are showing, so it's reflected the dynamics of the diseases, trends of the diseases, and also it can give a useful information regarding the prevention and control measures regarding the diseases. This has been also established and it is already implemented in COVID-19 here in Saudi Arabia, Sentinel surveillance system networks. Now, by networks, the health authorities could recognize the dynamics of the diseases, and they can promptly provide the precautions and the prevention measures for that particular and specified area or places. Here also, another examples, global public health intelligence networks, national electronic disease surveillance systems, and electronic systems surveillance system, early notifications of community-based implements. I just want you to focus on the last ones. The last one is the types of surveillance system, but this surveillance system, it's based on community. It means a community based. In this types of the electronic softwares or electronic informatic systems, the health authority used to train, recruits, train, and facilitates key informants or community informants in different areas where we have a high risk areas to a particular type of disease which under the focus of investigators, like communicable diseases are under the eliminations or communicable diseases under eradications. I have witnessed these types of surveillance community based when I was attached with WHO during measles and polio surveillance. We used to give this software for the key informants, key communities, to provide acute flaccid paralysis cases. So this will give even easy reporting, even for the people who are in the headquarters of WHO. So all the people who are responsible on the programs, either from WHO headquarters or WHO country level, or even WHO state levels, and the coordinators, they are in one time with access to see where the exactly AFP cases and how the situations is going. And this is give a great chance to opportunity to them to give a prompt measures for this prevention and control, as the immunization contacts, making surveillance, active search, and so on. And also it has been used for measles and Ebola in the last initiations of the last phase of Ebola eliminations. So it's very useful. But we may, by the end of these lectures, we will see what's the most challenges that is makes these things is very difficult and not easy to be implemented. Informatics and public health data systems. So talking about public health, it means talking about data, as I mentioned. And public health, especially in diseases, either chronic diseases or as general definitions of diseases, whether it is communicable diseases or chronic diseases, it could not be completed unless we talk about surveillance. And surveillance means aggregations, ongoing aggregations, analysis, managing of data, and using this data finally for public health practices or public health intervention, whether in prevention control or in plannings or decisions making or whatever, or for evaluations of the programs in public health. So the timely disseminations of the data that is responsible for prevention and control, it is the key public health functions, and timely and completeness, and also high quality of the data. It's very important in public health. These three important things could not be achieved unless we have a strong, tied health informatics system with the communication system, because we are not going only to collect, analyze, and finally prevent the data. We need also to initiate the system of the feedback, which is needs to a good communications, which is the good communications to come out with the highly achievable outcome. Now, informatics, because it is encompasses data systems, no informatics without data, it's closely tied into the public health surveillance. No surveillance also without data. We can't achieve both unless we have a great pathway for the data collections. Even if you never analyze, this is like to just put you other situations as you are professionals. In case of you are not in deep knowledge about the how you can use the geosystems using the sophisticated software materials used in health informatics or in information systems, still you need to know the basics about the surveillance system, because finally the quality of data is your responsibility, and you have to examine, you have to test the quality of data before using it, because you cannot depend on the untrusted data. So that's, you have to understand the systems very well. We are not looking only just to gather the data. We have to look for the other obstacles that it could face us. Like the data it come to be useless if we don't have a feedback. So feedback is important to prompt interventions for the prevention and control measures. And over-reportings, under-reportings, missings of data, like poor quality of reporting, poor quality of data, poor quality of trainings of people who are preparing the data. It's also is a way of focus. I mean, it is area of focus. We suppose also to have a focus on it. Purpose and uses. Purpose as uses, just like think about data linkage to communications, communications links to informatics. So they are all together. So why we are gathering data, what type of data that we need, in what purpose we are, in what space we are going to collect the data. To answer this question, that is means this is your system in informations or informatics, because you need communications, you need also high quality of the data. Knowing why data system has been created is important, and it's the first step. Even I believe you know that is when you are going to decide and disease for surveillance system. First, you have to put your objectives. Your objective about these diseases. Like now, we are focusing, let's say TB as a disease under eliminations. So what's your objective? And why are you selecting this disease? Are you sure that this disease is going to be eliminated in a particular regions or not? Those are supposed to be understood before starting the system. Developing and maintaining a data systems involve the use of resources. Think about these resources. It's not an easy job. It's not an easy way to develop an information system or maintaining, because not only you are developing the system, you need also to maintain, to make an update with systems, to replace, to make a refresh training, to make a basic training. So it's not something you did. You do it first and forget it. You need to take care of it by maintaining the system from the different ways. This is all our resources. It means our money. So this is money, this money. That's why there should be a clear and compliant purpose of the collecting and using data for public health actions. Don't gather and don't focus on something that is not importantly in public or doesn't have importance, public health importance. Don't gather data that is not in importance of use in a public health. So this is exactly identifying the or explaining and elaborating the importance of the uses of the data. For some health, even there may be a legal requirement of data collection, such as for health conditions. And this is what I have just explain it to you. Sometimes we may have to collect data which is focusing on notifiable diseases. And now we know that is we have a three main list: first A, B, and C. And this list, it has been manipulated or it has been adapted by the local authorities. I mean, also the Ministry of Health and WHO. We know that is some diseases has to be immediately reported to the WHO because of its severity or public health importance. Those it comes as by legal. So here, these types of data, it's supposed to be exist in our programs. Examples of objectives might include considering immediate public health actions or program plannings and evaluations. And this, we can just touch this is in here in Saudi Arabia, in our systems of COVID-19. Now, we have, in COVID-19, we have a series of protocols. These protocols, it give you step-by-steps public health interventions in case of any types of the situations, whether it is cases, contact cases, first contact cases, second contact cases, institutional suspensions, individual suspensions, community suspensions. So it is they are giving this is in details which is support the health practitioners to step by step implementing the procedures without fail. And this is a good practices. It has been done previous time. Data collections and data management, many of day-to-day activities of information involve attending to the details of data collections and management for information system. This is reflecting all the types of data that is collected through the sources of health care facilities. Data source collected from clients, either from the public health can range from laboratory values submitted. It could be sources, other sources. Some of these are electronically submitted. Some of them are by manuals way of submissions, and also individual nurses, local public health clinics, doctors, office making for also reportings is accepted in some areas, in some situations. Also to support the prompt and immediate response of the actions, sometimes we may need to specify the way of providing the notifications or the report. The sources of data ultimately collected and included in public health data systems are often decentralized. It's come from different, different sources, which could be included primary health sector centers, referral hospitals, rural hospitals, general hospitals, from pharmacists, from laboratories. So whatever facilities belong to the public health or belong to the health facilities could be assigned as a source of the data that could be used on decisions maker evaluations or public health purpose. Performance by the different local or state health departments, they are used to provide checks to completeness, check the appropriateness, timeness also, and then raise this for the above levels of management. I have discussed the quality of information, and it is important to give proper decisions or implementations in public health. This quality, it's not come as accidents. It's not an accident outcome. So this quality is depend strongly on the ability and expertise of those individuals and organizations. So this informatics and informatics system it's not run itself. It needs a personnel, experts, ties people to operate this system. So level of ability, expertise of the organizations and on individual, it determines the level of the quality of the informations that comes. Also the trainings, you know, that turnovers of staff, personnel who are having the trainings, having the or running the system, we need to conduct a training, whether it is basics trainings for who new joins the programs or refresh trainings for the who are like having long time doesn't touch with the new updated facilities or new updated instructions in that system. So still we need to this. Experience is also how experienced people who are working in this field. It's also depend the quality of the informations and their familiarity with a system. We know that is a system, it is sophisticated day by day. So that is we are in need to have the refresh training for the people who already exist, and that training, basic trainings for the people who were already or who newly joining the programs. Okay, this is like a maxis, or we can say it's like one says for especially for researchers. The crucial part of the any research, I mean, as general, is the data collections, because you're asking questions and you are going finally to answer the question that you ask in the research, but you can't answer the questions unless you have a proper data. This data is depends on the level of the quality that you collected. High quality data, it means a good findings, which is answer your research questions, as we are talking about the research. Here in informatics in general, in public health, without attending carefully to data quality issue, there is a risk of G2 problems. Garbage in means garbage out. Whatever you are anyhow bring to the health system, it means that is this is it could be as anyhow also outcomes when we are analyzing data. So here we have to make sure that is our data is very or in high quality, and we are carefully attending the data by a different style tools and process of the making sure the data are used. Okay, legal and ethical principles. So ethicals and legal principles are essential for public health information system, as I mentioned earlier also. Different type of information that we are collecting, so we have to protect the privacy, confidentiality of this public health data, and the need to protect human also subjects from the potential of the misuse of this data. This is, I'm sure, all over the world, it's protected by the public health law, which is provide the level of using these types of the data. Legal and ethical principles and careful attention is needed to ensure that its collections, maintenance of the data are the safeguard. The issue is not only providing the facilities, training people. So here you have also to give attention to the maintenance of the system. Information system also can contain data that could potentially be used anyway damaging the individual, and this is coming back to the right of using the data, but not against the humans. And this is also under the articles and law of public health. Quickly, we will go for the challenges. we know public health informatics present a number of challenges. We have just discussed the data, which is in terms of the legal issues, ethicals, or the data management. The other major challenges is including oversellings, overestimations of the system itself, applications, and systems that are not user-centered and fundings. Put in your mind that is managing the data in public health or using informatics in public health, it means resources. So that is why we still have in some like developing countries, they're still struggling in terms of this data and data management because of their levels of like economical levels. So this is, it could be the principle of the challenges. Overselling the benefits of public health practice is complex and complicated endeavors. Mere availability of more health-related data and other types of information presented in an understandable format will not address the long-standing root causes of many health problems, such as still we have very good in many countries. We have a very high quality of health informatics, but still the problems in public health disparities could not be solved as a great roots, and also lack of health assurance. Providing high quality data from highly developed and established public health informatics system that is not means solving some public health problems. Still, you need expertise people to elaborate that's informations, and still you need fund, you need facilitations to provide interventions in area where you need interventions. And this is makes the missions, it will be difficult because still we have a complex of individuals problems. We have all the data, we have all the information, we are recognized even the problem, but still we cannot make our interventions. Organizational also problems and social problems are not resolved by quick and easy technological fix. So this is another way we can say it. Even in the countries, developed countries, where we have these good systems of informatics, still we have some health problem. They will not be able to solve problems. Because this information overload now, much large challenges in the fundamentals of the communications, we have grids. In some areas, we may have an overload of data and information, but still people doesn't know how to deal with this. Not easy, but obviously it not means that we can, with easy way, solve the problem. This is translating what I'm just replying to you. When you consider public health information system and technology too complex and difficult for general use, this stems from the failure of public health information technology and system developers to thoroughly understand the process and organizations in which data and other informations are collected. Still, in some areas, we may find people that they think the complexity of this public health information is very high, but this comes because they doesn't know how their systems works and the system how. We solving these problems could be by sensitizing people who are in decisions levels, and sensitizing managers, sensitizing people who are operating the systems. By spreading and disseminating these cultures, we may make sure that we can achieve the goal on using this. Expense, as also I mentioned, health informatics depends on the financials. So, and IT systems can be financially expensive to squares, providing, develop it, operate it, and make a maintenance systems is not an easy. It is necessary to remember that just because data can be digitized and stored in electronic information system. So finally, you are coming to see all, who captures all the data in an electronic system. So that's why the data for establishing these systems is became very difficult. Also, funding for public health comes from the governments and from taxpayers. So we have different sources of the funding of public health. But we know that is especially in developed countries, the public health is not a priority because of the services agencies. So initiating this health information system will not be as a priority, especially for decisions makers to support it. And in case of any failures, economic failures, public health also usually face these funding issues. At the conclusions, public health informatics present a new opportunity to support all activities in public health. Two of these most important are enhancing ability to communicate directly with publics and increase confidence of the public health and medical healthcare information system. And information technology advances to provide unprecedented opportunity for the general public to receive or to obtain health information, either from information seeking websites. People can know or have this types of bits knowledge about what they are seeking. Active communications effort on the part of public health agencies also could be implemented. Informatics and IT advances allow segmentations of areas by demographics, preferences, and activities, like the way that now here in Saudi Arabia now, all informations about this COVID-19 is captured. Now the government knows how many of the populations having first dose, second dose, how many started the third dose, how many of them are out of vaccination because of they are contraindicated to have the vaccine, and even the locations of those people in the map of the Saudi Arabia. So this is all comes because of these informatics. Detailed segmentations also could be pursued sharply to target this opportunity. As here we have examples to individual with insulin. So now we can know who are individual who having insulin resistance diabetes and also who are at risk for the stress. This is like example just to show you how detailed we can segregate it from this information system and to make everything easy for people who are having decisions to provide or to push the interventions to the community. Thank you very much. Do you have any questions? Hello.
Thank you so much دكتور for this informative lecture. بس إذا ممكن دكتور من فضلك ترسلي المحاضرة.
ممكن أرسلها الآن على الزوم؟
أيوة أكيد.
خلاص.
شكرا يعطيك العافية دكتور.